Hi everyone, good morning, happy weekend. I'm here again today. I want to talk about sexually transmitted diseases or infection. So before I go further, please kindly like, share and follow my page. So sexually transmitted infection is also known as a sexually transmitted disease. It is infection that is gotten through one infected person to another to another person through sexual intercourse or sexual contact. According to CDC, they said that there are more than 20 million people in the United States that are infected each year, every year, and about half of this 20 million people, that is 10 million people infected the age of within 15 to 24. So, but luckily, most of the STD or STIs, as a sexual transmitted disease, has a cure. So the types, there are many types. There is more than 20 types, but I'm just going to list just a few. The types of sexually transmitted infection are chlamydia, gonorrhea, HIV/AIDS. We have hepatitis B and genital warts and co. So, and the causes is mainly bacteria, virus, and parasites from an infected person to another person that is not infected. So the person now will then become infected. So, and the route in which this person an individual can be infected is through sexual intercourse, through vagina, penis, mouth, maybe the people that engage in oral sex, and the anal canal people can be infected through that route. And people are at risk of STD or the sexually transmitted diseases. Everybody is at risk, but the most people that are more prone to this infection is people that teenagers and young adults. These people that they tend to go into sexual acts, and when they go to sexual, they don't know how to protect and prevent themselves from getting this infection properly. So most of them, they are not enlightened, so they don't have knowledge on how to protect themselves. So these people, they are prone to be more infected with STI, to come down with STI more than older adults. And people again, drug users, people that share drug users, like people that use drugs that they share syringe, dirty syringe, used syringe, they are more prone to have STI, because the main cause of STI is through sexual intercourse. But when an infected person has used a needle that is already infected, and another person that is not infected use it, in the process, the person too has been infected. And even through on-screen blood transfusion from an infected person and give to somebody that is not infected, the person can be infected with this microorganism. And signs and symptoms, what do you say in people that have this sexually transmitted diseases or infection? In men, you see them, they have burning sensation and itching on the penis, and there's discharge from the penis, there's burning sensation in the penis. When they are urinating, they have serious pain, and when they want to go to toilet again, some of them come down with pain in the bowel, and they always go to bathroom, use the toilet, they have the urge to go and be urinated. There's frequency, they're always going to urinate, and maybe when they will go, you just small urine they will bring, so they have difficulty in emptying the urine. And the signs and symptoms in women is that women, they have a burning sensation and itching in the vagina. They have discharge that the odor is not okay, offensive odor in the discharge. They have pain in the pelvic region, and they have bleeding from the vagina that is not normal, and they have pain during sex. They have dyspareunia, they have pain when they're having sexual intercourse. They don't enjoy sexual intercourse. They don't find sex fun lovely, as they don't enjoy it because of the pain. So in the vaginal area, you will see that they have sore, they have bumps, they have blisters around the vaginal area, and they always come down with pain too when they want to urinate, and when they want to use the bowel, as they want to poo, they used to have pain. And again, some of them used to have always go to toilet to use the toilet. There's frequency and urgency in them. So even some may even lead to the extent that when they are urinated, they will pass blood in the urine. So what are the diagnosis, what are the things that that can be done to be able to establish that this person is having STI or sexually transmitted disease. The first thing is that history taking. Your consultant will take history from you, and they will do pelvic exams, and they will do vaginal swab. They will take vaginal swab from the penis to be able to do culture, to know what is the offending organism, and urinalysis will be done, and other blood tests will be done. So after then, the treatment depends on your consultant. Your consultant will decide the type of treatment is going to give to you. Like when after a series of investigation and the results of the test will determine the type of drugs or antibiotics going to place you on that will be able to fight this microorganism that is causing this problem. So luckily, most of, as I said earlier, most of STI is treatable if noticed on time, and the damage can be reduced. But some of them, they are not no 100% treatment for them, can only be managed. So disease like HIV, no permanent cure, but it can only be managed. But that does not mean that one will not live life to the fullest. So life goes on. So anyhow you are diagnosed, you should just take it, and but the most important is that you should try to prevent this infection. So what are the complications of STI, sexually transmitted infection? Is that there is pelvic pain, there is pregnancy complication, there is arthritis, there is pelvic inflammatory disease, there is it can lead to infertility, and there is certain cancer, can result to certain cancer, like the human papilloma virus can lead to cancer of the cervix. As for the infertility, this infection can end up narrowing your fallopian tube, and to make this woman to a longer run when they want to have children. They may find it difficult for them to have children because of this infection has already go and cause scar in the fallopian tube, and the tube is either is blocked or it will be narrow, that will not enable fertilized ovule to be able to pass through to the uterus. So what are the prevention of this of STI, sexually transmitted diseases? The prevention is by abstaining from sex. You can stay away from sex. So if you cannot stay away from sex, you should be with one uninfected partner. And again, the next thing again is watch and wait. If you just have new partner, you people should watch and wait by going to do routine text on both of yourself to check to check whether you people are clean, as in you are not infected with any type of infection before you can engage in sexual acts. And again, get vaccinated, like hepatitis B, A, and they can be vaccinated. You can get vaccinated, so to make you have immunity against this infection. And again, human papilloma virus too, there is a vaccine for it too, to prevent you to have it in later life. But it's not for older adults, is for young teenager that has never been exposed to sex. That is when you take it before you can engage or you can be exposed to sex. So when you want to take the vaccine, when you go to the vaccine center, you will be health educated on things and how it goes. So the next thing is that you should drink less alcohol, because when you take too much alcohol, you tend to not be able to know what is happening in your real world. And these people that take alcohol, they are prone to have sex with somebody that is not even their partner, because at that moment they are not 100% themselves. And you should control your alcohol intake to prevent this, not to go and engage in sexual act with somebody that is not your partner, that you know who or what he or she measure. So we should communicate with each other, as in when you and your partner, when you first of all meet each other, or when you want to start a relationship, to discuss you communicate in terms of having a safe sex. You can use condom. There is condom. Use condom and protect yourself from if you are not sure of each other. If you have not done the necessary routine test and every other thing, use condom to prevent yourself from having this type of infection. And again, if you know that accidentally you are exposed, and you are not sure of the person you are exposed to, maybe it's not your partner, you can go to the hospital and explain within 72 hours of that exposure, and explain what you're engaging, and pre-prophylaxis exposure measures will be done for you, will be given, you'll be placed on drugs to prevent you from having coming down with STI or STD. And the conclusion of this talk is that we should know that STI or STD, they are preventable if we all adopt a positive lifestyle. And how is a positive lifestyle? We should try to take necessary precaution, use condom when necessary. You should not share needle with somebody. Once you use needle, you discard it. And again, you should limit your alcohol intake. Try to adopt a positive lifestyle, and go for routine checkup. Always go for routine checkup to know your status, to know how you are doing and how you are faring. And again, when you notice that there is problem somewhere, maybe you notice anything, try to see your consultant, try to see your physician on time, so that proper measures will be settled and the damage will be reduced. And also, again, we should also know that our health is wealth. No matter what, if you like gather all the whole money in this world, and if you don't have a good health, you'll not be able to enjoy the money. So health is very paramount. We should take care of it by staying positive and living a positive life, and avoiding things that can expose us to sickness and diseases. So at this point, I'm going to bring the talk to an end. So thank you very much. Happy weekend to all of you, and please don't forget, always follow, share, and like my page. Thank you.